Hi. So I just thought it would be simple if I covered induction methods now when you could watch this at your leisure. So there are several different methods of induction. One of the ones that you may hear about, it isn't really considered a method of induction, but it's called stripping the membranes. And what happens is that the amniotic sac and the chorionic sac are uptight against the cervix. Okay, so they're uptight against the cervix here. And so the care provider will take their sterile, gloved hand, put it inside the cervix, and then push those membranes, that amniotic sac and that chorionic sac, away from the cervix. And this is like a cervical massage. So a person has to be at least 2 centimeters dilated in order for them to do that, and usually 3 centimeters. And so the idea is that we're helping things along. The negative side is that it can introduce infection. And if the person isn't ready to go into labor, it isn't going to do anything. Okay, so it isn't going to be helpful. Now, what causes people to go into labor is a conversation between the placenta and the baby, that they decide the cue when labor is ready to begin and the baby is mature and the placenta has done its job. Okay, so what happens in those final 48 or 72 hours is that the uterus develops more receptors for oxytocin on it. Think of it kind of like electrical receptacles in the wall, that you've only got a certain number of receptacles. So you can only plug usually 2 things in. Maybe you can put a converter on top of it where you can plug 6 things into a 2-pronger. Okay, so that's what we're talking about. We're talking about adding more receptors. So in that last 48 hours, or 3 days pretty much, is when it starts to develop lots more receptors so that it can take in all that oxytocin and have those regular progressing contractions. So that's why somebody can check in for a Pitocin augmentation and be given IV Pitocin, and it doesn't go anywhere because there aren't any receptors. Okay, so that's the first thing you need to remember, is there has to be oxytocin receptors. So now let's look at our slide here about different methods. Another method is, so we have talked about Pitocin several times in the class so far, so I'm not going to go over that again. Another one is rupturing the membranes, artificial rupture of the membranes. That's AROM. And as we said, that starts the clock for infection. In the Born in the USA movie, they established that there is no evidence for that, although doctors like to do things, and it's something they think can help move labor forward. Well, if the baby is malpositioned, all it does is deepen the malposition, and it makes it less likely that the baby can adjust in that natural alignment plateau that we've talked about. Okay, so the only time rupturing of the membranes has been shown to progress labor is with a multip, somebody who's had a vaginal birth before and is at 8 or 9 centimeters and has been there for at least an hour and a half. Okay, then we can assume that that big strong bag and that cushion of water is keeping things from moving forward. All right, so what else do we have on our list? We have catheters. Okay, catheters look like this. Okay, this is the Foley catheter, which is intended for bladders. However, so it's inserted there into the into the vagina, in through the cervix, into the uterus, and then it creates a balloon. Here's the Cook's catheter, which is another diagram. So that goes in flat, and then they fill it full of sterile water. And the idea is it irritates the cervix dilates. Once it reaches 4 centimeters, the Cook's catheter or the Foley catheter will fall out, and labor has begun. Okay, and there's now no future problems or complications from using this method with the labor. Okay, it's used up. The next one is Cervidil or prostaglandin gel, which looks like this. Okay, it's small. It's like a little shoestring. It goes up near the cervix. It has hormones in it that cause the cervix to break down. And that breaking down process causes contractions. This costs about $350 a dose. Some places like here in Madison, people will come in the evening, have a dose of Cervidil put in, and then they'll go home. If you're in a rural area, they may require you to stay overnight. They treat it like any other induction method, okay? So it really depends on the practitioner and the area. Someone may get as many as 3 doses of Cervidil 3 days in a row. That's not unheard of. That helps buy time for the spontaneous labor to begin often. The last item on here is misoprostol or Cytotec. Cytotec is a very colored history. When it first started to being used, it caused maternal death. And since it was used most often on poor people and people of color, it's one of the reasons why people of color have good reason not to trust their practitioners when it comes to medical care, because it's one of the ways they were experimented on. Tasha Oden is the first person to have died, and her mother publicized that, and there's a Tasha Oden Foundation. Cytotec is a drug that is used for stomach ulcers. It is not supposed to be used for labor. It is a part of the abortion drug in order to cause the uterus to cramp and the cervix to cramp and the contents of the uterus to be expelled. So you may have heard about it in that way. The manufacturer of the drug has a black box warning on it, which says do not use on pregnant people, do not use to start labor, because they don't want to be sued. They don't want to be liable for that. So that means any doctor or midwife using Cytotec or misoprostol is using it at their own risk. Now, why would they use it? They use it because they feel they can control it. They feel it's worthwhile, that we've learned from our mistakes in the last 20 years. And now they're giving the drug orally rather than putting it up near the cervix. I've had mostly negative experiences with it. Other doulas have had really, really positive experiences with it, especially the 25 milligram or microgram pill. The 100 one is the one that they use for stomach ulcers, and they would then cut that up. So you will find where you live that Cytotec or misoprostol may be a well-respected drug, or it may be something that is frowned upon, okay? Because it varies region by region, whether people use it or not, okay? So that's your briefing on methods of induction, and I will see you next week. Thank you very much for your attention today.